Good evening and welcome to The Probe. Tonight we assess our preparedness to reopen schools at the various levels amidst the raging COVID-19 pandemic. 346 deaths, 1,776 active cases. Amongst others, scientists have described the situation as dire and wants Ghanaians to take their safety into their own hands amidst consent about the country's management plan. We're live on Joy 99.7 FM, a dozen affiliates across Ghana. Joy News Channel free to air on your digital platforms, DSTV 421, GoTV 144, my joyonline.com social media platforms. Get interactive now. We start off from the Jubilee House with updates number 22 from President Akufo-Addo.
Adhering to the enhanced hygiene and mask wearing protocols that have served us well and which led us to the situation where we were witnessing a gradual decline in the number of active cases. However, we have seen an upsurge in the number of active cases, from a little over 900 to 1,924. Our COVID-19 treatment centers have gone from having 0 patients to now being 4 because of the upsurge in infections. Particularly worrying is the fact that the Ghana Health Service is recording on the average 200 new cases of COVID infections daily. The number of patients requiring hospitalization and intensive care is rising. The number of severe cases, which stood at 18 a week ago, has increased sharply to 120. 2 weeks ago, there was no critical case. We now have 33 in our treatment facilities. Again, according to statistics from the Ghana Health Service, the considerable number of persons who are severely ill are surprisingly relatively youthful persons with no previous underlying health conditions. The number of confirmed deaths has increased sadly from 338 persons to 352 within the period. Recent genomic sequencing undertaken by our scientists have established that some arriving passengers tested positive for new variants of COVID-19. These passengers have all been isolated. Furthermore, work is ongoing to determine the presence and extent of spread of the new variants in the general population. Detailed investigations of the cases indicate that apart from arriving passengers at our airport who tested positive, infected persons have recent histories of attending parties, weddings, end-of-year office programs, family get-togethers, and funerals. At these gatherings, most of them abandoned the use of the masks and were engaged in actions that led to them contracting the virus. Fellow Ghanaians, at this current rate, whereby 13 out of the 16 regions have recorded active cases, our health infrastructure will be overwhelmed if the situation continues. It will severely undermine the efforts government is making to revitalize the economy and put our nation back onto the path of progress and prosperity following the ravages of the pandemic. And 7 generals, I swore to them. Unquote. It is my duty to protect lives and livelihoods. In furtherance of this, I've instructed the Inspector General of Police to direct officers, men and women of the police service, to ensure the rigorous enforcement of the law on mask wearing at all public places and in public transport. They're also to ensure the closure of all nightclubs, pubs, cinemas and beaches that may be operating in defiance of the law. They will be assisted by the other security agencies if need be. Persons in marketplaces, workplaces, and operators of public transport must conduct their activities in accordance with the hygiene and safety protocols. The wearing of masks in these places is mandatory. Regulatory agencies will undertake random checks to ensure conformity with COVID-19 rules. Should any facility or institution fail to comply with these directives, its activities will be immediately prohibited and appropriate sanctions applied. It is important that I remind all Ghanaians that severe punishments exist on our statute books for persons breaking the law on the mandatory wearing of masks. Should anyone be arrested by the security agencies disregarding this directive, that person will be dealt with strictly in accordance with law. We do not want to go back to the days of partial lockdowns, which had a negative impact on our economy and on our way of life. But should that become necessary, that is, should the number of active cases continue to increase at the current rate, I will have no option but to reimpose these restrictions, because it is better to be safe than to be sorry. So together, let us all ensure that we respect the protocols. Government is intensifying its strategy of enhanced 3 Ts, i.e. tracing, testing, and treating, to allow us to identify infected persons, isolate them, and treat them. A considerable number of contact tracers are being mobilized to follow up on contacts of all who test positive. All laboratories, public and private, must supply in real time data on all persons tested on the common platform established by the Ghana Health Service. There will be sanctions against laboratories who fail to comply. We've also provided additional logistics, including vehicles, to the Ghana Health Service for the supervision and monitoring of asymptomatic cases being managed from home. Additionally, government is reactivating available treatment and isolation facilities across the country in anticipation of any further increase in infections. The provision of adequate medicines, equipment, and personal protective equipment to enable health workers attend to home-based patients is being effected. Fellow Ghanaians, as our children in kindergarten, primary, junior high school, SHS2 and SHS3 resume school from tomorrow, I wish to reiterate that government has taken the required steps to ensure their safety in school. Heads of institutions, as well as their teachers, have undergone the requisite orientation on guidelines for school reopening during COVID-19 to enable them assist with compliance of students with the protocols. I've been encouraged by the preparations being made by many schools, in some cases with the support of their old Students Association and PTAs, in anticipation of the return on Monday. On our part, government has also undertaken the fumigation and disinfection of schools and the provision of sanitizers, masks, liquid soaps, Veronica buckets, rolls of tissue paper, face shields for learners and staff with hearing impairments, and gloves for caregivers and attendants to schools across the country. All senior high schools have been mapped to medical facilities across the country so that any outbreak of the disease in any such school can be duly contained. Suspected cases in primary and junior high schools will be managed by district health teams through the school health program and the COVID-19 rapid response teams. The world is facing a learning crisis, a crisis that is further worsening inequalities in access to education, with children from poorer homes and communities being worst hit. This learning crisis has serious implications for the future of our country. This is especially worrying for me because I have placed education at the center of the social and economic progress and prosperity of Ghana and of our political stability. That is why, in our attempt to mitigate the impact of the pandemic, the Cab Bus Initiative, being administered by the National Board for Small-Scale Industries, has started disbursements to applicants from private educational institutions, many of whom have been hard hit by the pandemic. More disbursements to these institutions are being processed. And I wish to speak directly to the students and children returning to school, and those of you who have already returned. I know that for most of you, 2020 was a very unfamiliar year and presented a setback for your preparation for the future. You all saw the struggle your parents, especially working parents, went through with you at home due to school closures. You also know how you struggled to learn from home, even for those of you who were lucky enough to continue with some of your classes online. The frustrations, the idleness, the absence of classroom or study group intimacy, it has all been extremely difficult for you, your parents, teachers, and everybody involved. This is something we should all try to put behind us. Much of that depends on you. As we take these big steps to go back to school, your attitude, your behavior, your self-discipline will decide whether or not our schools will remain open. I'm pleading with you. Please observe the COVID-19 protocols at all times. You must maintain the level of discipline and sense of responsibility to stop the virus from spreading in your schools and for those students at home as well. Wear your masks at all times. Wash and sanitize your hands regularly. Protect yourself. Protect each other. Protect your teachers. Protect your parents. But please, do not give me a reason to close down schools again. I pledge to do my best to keep your education going. I want you to assure me, your parents, your teachers, and society as a whole, through your actions, that you will do your part as well. Fellow Ghanaians, I urge all of us to continue to live responsibly with the virus, even as we work towards accessing the vaccine. Details of the access and rollout plan will be announced very soon. Let us work constantly on how to do our work, keep our businesses and places of worship open, and send our children to school, all in safety. Government, for its part, is resolved and determined to help ensure that we're able to return to our normal daily routines. That is going to work, going to school, going to shop, going to the market, going to a funeral, going to the pub, going to the club, going to the cinema, going to the beach, going to the stadium, or going to worship. We can achieve this result if we cooperate and work together. It is essential that we protect ourselves, our families, and our loved ones from the virus. It is a collective responsibility. If we embrace the safety protocols, that is the enhanced hygiene and mask-wearing protocols, and we continue to put our faith in Almighty God, we will see the light at the end of this tunnel. 0 active cases. That is the goal. We can and must reach it. Enuanom, makase yare enyankoye. Man ho so biom. Aba pese oboye nyina ho ban. Nti sise ayaye e fa yare no ho no. Ye beba ahwe se obia bedi so pepepe. aban no bia obetia mra no ebedi pa efri se ye ni abre epese ye pam yare efri asase so nti mesremu mundi hihye no so ititru mu shemas no anyame me iwi akeshi hila eyako ewo ehe ekun amlalo ntao ni ebu mofia mo he no ewo bejiano toni wo kefosie oba kwe ni mofia mo ketuni pepepe amlalo ke mofia mo ni babu mla bayewa no wo mi panyefai ye ke bejiano toe atuni titri mask wear. Fellow Ghanaians, in all sincerity, I repeat that this too shall pass, for the battle is the Lord's. May God bless us all in our homeland Ghana and make her great and strong. I thank you for your attention and good night.
That's update number 22, just gone by President Akufo-Addo from the Jubilee House. That's our situation now as we stand as a country. COVID-19, active cases, 1,924. We have 33 critical cases. He admits that our treatment centers are full. We have 352 deaths, previously 338. That's what we had. Now we have 352 deaths. That's where we are now. Our genomic sequencing has revealed that we have new variants tested, imported. We found it at the Kotoka International Airport, amongst others. And then also, you should know that from now onwards, the IGP has been instructed to ensure enforcement of protocols. You will be punished severely if you're found not to be observing the safety protocols, i.e. wearing your nose mask, social distancing, amongst others. So we'll be interrogating these issues, and then also he's been speaking directly to the students who will be going to school starting tomorrow, KG, primary, JHS, amongst others. And some responsibilities expecting from you, our children. But how are we supposed to get responsibility from KG students? We'll be interrogating that as well. He doesn't want us to go into a partial lockdown, but if the situation continues and it becomes necessary, he will do so. That's what you should know. So far, that's what the president has been talking about. And thankfully, we have our guests in the studios tonight, the Director Generals of the Ghana Education Service and the Ghana Health Service, Professor Kwesi Opoku-Amankwa and Dr. Patrick Abwaji. We'll be joined shortly via Zoom also by the representative to the Ministry of Information, Kojo Nkrumah. Thankfully, he's joined us via Zoom. Thank you very much, gentlemen, for joining us for tonight's edition of The Probe.
Thank you. Thank you.
So let's start off on Zoom with Kojo Nkrumah. Thank you very much, sir. So I would first want to find out the part about the enforcement of the safety protocols. The IGP has been instructed to do so. I would first want to find out if the EI is still in force or we are yet to take it to Parliament for a renewal.
The executive instrument, good evening to the directors in the studio and to your viewers. The executive instrument is still in force. And the president, in his instructions to the Inspector General of Police, is asking for a step up in enforcement. You notice that until now, what the police has been doing is a lot more compliance-related education and encouraging people to comply. But we are now at a dangerous point in this COVID-19 response program. And as the president mentioned, staring ahead of us or staring us straight in the eye is the possibility of a lockdown, which comes with a lot of consequences. The only way to avoid that is to ensure that we have higher compliance and that we do not continue to record this trend of growth in daily cases. We're currently doing about 200. If you look at the 7-day moving average, about 200 a day. That is dangerous. In a week alone, that's about 1,000 plus. And the only way to avoid that is to ensure that we have higher compliance so that there will be no need to go that high in terms of the response mechanism.
But in all sincerity, Mr. Oponkuma, is the president convinced that this is a prudent decision? Should our children actually be going to school starting from KG? Should they be going to school tomorrow? He's talked about him being convinced, but really, in all sincerity, is he really convinced that we ought to be going to school tomorrow?
There's nothing that the president says that he's not being sincere about. In all this COVID-19 response program, he does take every decision and every step with the highest level of sincerity and responsibility. Today, for example, he's been in the chair for about 5 hours, arriving at some of these final decisions before announcing them in the country. And he doesn't take these decisions lightly at all. Now, you need to separate the current uptick in cases from our ability to live and continue our lives while the virus remains in the global ecosystem. With the current uptick in cases, as the president explains, the detailed analysis of the new positives that we have is that during the Yuletide season, a lot of us were reckless. The recklessness at many of the gatherings.
Not just the Yuletide, the election period also. The election period, not just the Yuletide. The campaigning.
Well, if you take the election period, I'm sure the doctors in the studio will tell you the data will not support that argument. I know it's fanciful for us to make that argument. Election period was on the 7th of December, thereabout. So you're looking at about 14 days around that period. You don't see those numbers. But the Yuletide, the 25th coming to the New Year era, you'll notice, and they even have specifics when they do the tracing, they have specifics of events under which persons turned positive, which is now what is leading to the about 200 average cases a day. There's clear data and clear science to support this argument. So I want us to be very clear on that one. Now, there is the need to contain that. Containing that means that the non-compliance needs to be worked on, and that's why it's asked the IGP to move with his officers and men from this week to ensure that compliance is higher. Also ensure that some of the places where we are finding out that these outbreaks are taking place, which ought not to be opened, there is more enforcement in ensuring that they are not opened. Then there's a general compliance with the personal hygiene, etc. And then finally, the challenge that we have with the contact tracing system currently, which we believe has allowed some more spread that was not initially contained. You hear Mr. President has made some very clear instructions on how to do that. That comes in two parts. The first part is the private labs that are not providing information on positives and contacts of those positives. And sometimes when they provide that information, it's about 3 or 4 or 5 days late. The consequence is that these persons would have then gone on to spread some more because they were not isolated. And there are very clear directives that have been issued from this afternoon and sanctions that are applying. I'm sure Dr. Aboagye will give you some more details on that. Okay. The second is that we need to shore up the number of contact tracers so that we can put a blanket on the current uptick and arrest it as soon as possible. So in terms of the current uptick, these are the plethora of initiatives that are being used to deal with it. Then you come to the reopening of schools. Some are already reopened, particularly for those that are boarding facilities. It is very or relatively easy to manage because they are grouped in one place. They are mapped to medical facilities. And should you have any outbreak, you can contain them. Of course, this is apart from the fact that you are making available the necessary protective items as well as the protective behavior knowledge that is being spread there.
But in this case, sorry to cut in this case, we didn't hear what exactly or the amount that will be provided, because previously when the SHS were opening, the president mentioned that we're going to get 3 face masks each, amongst others. But this time, you only said that they will be supplied, but we didn't get the details. Do we have the details for that?
I don't think that the numbers differ from what we've been doing, even in the limited reopenings. But I'm sure by Tuesday morning, when Dr. Aboagye and Professor and myself engage the country, if we have to provide some more specific numbers, so the total volumes of gallons of sanitizer, etc., and number of face masks, we can get into that one. But suffice to say that the logistics to ensure that schools are prepared are being made available. Okay. And then for those who are going to the day schools as well, the school health programs are activated to deal with it. Now, if we comply with A, what we need to do to deal with the general uptick, and B, what we need to do to ensure that school reopening goes well, we should not have a problem. Of course, usually in these things, you have one or two places where compliance is low, and those are the ones we have to look out for and then deal with. But the president takes all of these decisions meticulously and in all sincerity, and is bringing all of us around the table to ensure that we're able to deliver. How
many hours will they be in school? I'm sure Professor Kwesi Amankwah is here, but I didn't quite get the president mention that.
No, it shouldn't be that president.
I'll let Prof deal with all of those numbers in terms of school contact hours, etc.
Great. That's Mr. Oponkruma. Thank you. You stay with us because we have a number of questions that people will still want answers to. But Professor Kwesi Amankwah and, of course, Dr. Patrick Aboagye are with me in the studio as well. So I'll start with you, Professor Kwesi Amankwah. The issues about how many hours, for instance, our children will be in school starting from KG. Let's start off from there. How many hours?
Thank you, Emifa, and good evening to our viewers. For the KG, the proposal is that they'll go at 8 and finish at 12. The primary JHS will still do their regular time, where they finish around 2:30, thereabout. Yeah. So that is the arrangement for the.
And the JHS?
Yes.
It's also 8 to 2:30. Yeah. Strictly, we have to adhere to that.
Unless otherwise.
Okay, but I'm worried about the KG. I'm a working mom. If my child is in KG, 8 to 12, they close at 12, I need to pick them up at 12.
Yes, that's a discussion that we've had over the period. And we had various views to it. For example, we know that for most schools, the children go, the siblings are in the same school. So when they are done with, when KG closes, they will usually go and join their
siblings.
Their siblings or thereabout. But at the same time, for that group of children, we also realize that their learning is basically playing. So if you restrict them so much over a longer period, it becomes a bit difficult. The idea is to get them into the frame of going to school. So if they are there for a time, then they could also be allowed to go home. What it means is that we, as parents and as a general public, we need to get to this new normal and then have arrangements that will help us to support the children whilst they go to school. Yeah.
How is the KG student supposed to observe social distancing, wearing of masks and all? How are we hoping that that will happen? Because the president is asking them to be responsible.
Yeah, I'm not sure that was directed to the KG students.
It's for all the children, KG, primary, JHS.
Yeah, for them, we expect that their teachers and their caregivers will play a very major role in ensuring that they abide by these things. This is the first time that we're doing that, and obviously it may not be that easy. But once we all understand that this is a situation where we need to find a way of dealing with it, the caregivers, their teachers, and what we've also asked our district directors and the various schools to do is that there are a number of people who are the NAPCO and National Service. They should be deployed to support the
They should be deployed, or they will be deployed?
They will be deployed, if that they will be deployed to help with those numbers, especially in classes where they realize that the numbers are a bit big. The children have to necessarily go to school because having stayed home for all this while, it is very important that we start bringing them into the school environment and then the school culture, so that they can get used to it over a period. It may take time. We know that having stayed home for almost a year, it may be difficult for a lot of people. So what we are going to do actually is what we call recovery learning. They're not actually going to learn new things for a start, but we need to do some recovery learning. And There are people who probably when even they go to school, they want to be there to have that freedom of meeting their friends. But there are also those who, when they go to school, may have lost some friends, some relatives, some parents, and things like that. So while they are in school, you don't need to immediately start them from learning, but at least you need to do some bereavement response management. There are those who have lost touch with the routine and the structured way of doing things. Some of them wake up around 4 a.m. to get prepared to go to school. Now, for 9 months now, some wake up around 10 a.m.
Sometimes like 12.
Yes. So it's also important. It becomes a bit traumatic for them. So we have to have some trauma response management for them whilst they go to school.
Are we going to have any course, for instance, that deals with the current situation, the pandemic, and all that?
The counselors, you know, we have a guidance and counseling section. We have the girls' education unit. We have the SHEP. The president mentioned the SHEP, the school health education program, and they all work together with the Ministry of Ghana Health Service, and we've drawn up some things that we need to take.
Okay, I'm sure as the questions coming, there will be a lot that we need to deal with that you get to respond to. But Dr. Patrick Aboagye, at the time when we decided that we're going to reopen schools in January, we didn't have active cases rising. Now 200 per day, the trend. Now 1,924. So as I was saying, we didn't plan when we had this number of cases at the time that we said we wanted to reopen school. Now January is here and the situation has changed. Why then do you still give an advice that our children should go back to school?
Well, thank you very much. When you look at you have to look at the spread of the conditions. Of the 1,924, more than 60%, 80% are in Accra.
Okay.
The rest of the country is generally quiet. Where you have cases in the country, outside the country, you have clusters of people who in a group who have one case plus the contacts who are possible, very easy to contain. What we need to do is impact that, grouping all those things, then you need to also map your strategy that if Accra is probably hot, even for Accra, the demography is still within a certain cluster of people. And so within that, you should be able to plan your system and put systems in place to make sure you can mitigate all those effects and still go ahead. When we opened the JSS and the SHS for the first time, our active cases were much higher than this. Okay, and so we will need to prepare and put systems in place that allows us to go to school the same way with our active cases. We are still coming to work. And so it's a question of how to get the balance. But you can't compare
us to these children because of our responsibility levels and all.
It's people who carry the virus to work or carry the virus to school. So we are all responsible in ensuring that people abide by the protocol so they don't carry the virus from home or from the trotro or from some place to school and give to others. So it's a collective responsibility, and I think it's a question of getting a balance. And for me, once we know what we can do, we should be able to allow this to go on. Because if the numbers continue to go on, are we going to say there will be no more school in this country or in the world? And I think that is how...
Well, there will be other ways of educating, people have said, instead of en masse asking all of them to go back to school.
Well, you know,
does the science support what we are doing?
You know, the other ways of learning in school, even in advanced countries, there's significant disparity in people who can access the new norm, the new Zooms and stuff against others. Hunger, no data, no computers. I think one country just having to buy thousands of laptops for children, that's not sustainable. And so we still have to look at it. But we feel that still, despite that the risk is still something we can mitigate and allow the children to go to school.
Well, let's get into the first batch of questions at this point. We're ready with the first batch. So we'll start off from WhatsApp. This one from Israel says, I think we as Ghanaians need to take another look at the antigen-based COVID-19 test we conduct on international passengers arriving at the Kotoka International Airport. All scientists I've spoken with and even if officials of the Ghana Health Service agree the test is not as effective in directing the virus as the gold standard PCR, especially when we ask the travelers to go only come to Ghana when they have a negative PCR test. Yet, when they arrive at the Kotoka International Airport, we conduct a relatively inferior test on them and charge $150 for a test that costs far less. Still on WhatsApp, Dennis says, my question, so many countries have not hesitated to go on a second and even third lockdowns. What are we waiting for before we do so? Another one from Kingsley. Do we know our current reproductive number of transmissions and how has this been factored into our ability to contain the pandemic in the wake of the reopening of schools? How does our monitoring architecture look like since we are likely to be dealing with a potentially complex situation now that all schools will be in section? We have another one from Inshira. It says, when did Ghana get the gene sequencing of the COVID-19 virus? And secondly, the second wave has come amid the discovery of a new strain of SARS-CoV-2. What do we know about the new strain? And what is the standard of care for those with the new strain of COVID-19? And then I'll stay with Abubakar, final one for this batch. Kindly draw the attention of the Director General of Education to the fact that not all teachers receive the Teacher Professional Development Allowance. A lot of teachers in my school and colleagues from other schools didn't receive it. Meanwhile, we are all permanent staff. Okay, quite some deep questions there. So most of them to you, Dr. Patrick Abuaje. The new strain, people want to know more about it. When did we discover it? How are we hoping to care for people who contract this new strain of virus?
Thank you very much. We've been doing sequencing periodically. And as at the last time the president spoke, I think that was when November, we had not discovered any new strain apart from what we already had here. What we've done is that since the president spoke last and we decided that for those who are coming in, we will test them, quarantine them, isolate them, and sort of do a sequencing. And that's when we realized that among those we identified, some of them had the new strains. Now, so it is not that they have entered the country yet. What we are doing now is that we are now going to look at the general population again to see whether in all that there's been a leakage into the country. And I think that's when that comes in. We'll let you know. So what we have, the new sequence we have, is that we've done that for those who came in since the last 2 weeks, since we've been detaining them.
2 weeks ago.
That's what we have been testing. For those who are positive, we test them, do the sequencing. That is what we've discovered that. By now moving into the general population to see, now we have found it here. Now let's look at the general population, whether in all those periods we've had some new strains in the country. I'm sure that one comes, we will share with you.
But he's asking specifically how we take care of those who have the new strain. Like, is it different?
No, what
is there any special?
Is that once we isolate you, we keep you until you are negative. And so definitely you are not able to transmit the virus to anybody. But because the people have come in over a period, and also possibility that someone may have been negative at the time of testing but turns positive later, we need to look at the general population whether we've had some of such strains infecting to the country. And that's what we are going to do now. That's what we have started doing now.
It's surprising that we haven't started.
Oh, we've been doing a population-based screening longer. I told you, as at even November, that was the last one that was done.
Yeah, but since we discovered this new strain.
Oh, this is 3 or so days ago.
Okay.
It takes a long, sequencing is not like a dipstick and you get the results. It's a whole process. So once the results have come in now, that's when we're moving to the next step.
Okay. So Benis was asking, what will it take for us to go back into a lockdown?
Well, I don't know whether he was here during the lockdown. I don't know whether...
It's a she.
It's a she. I don't know whether she was here when we went through the lockdown. Lockdown is not anybody's... It's not anybody who likes it. Definitely, there are systems that will be put in place to prevent an escalation of the issue. When the time comes and we look at the situation, based on the situation, we don't have any specific benchmark that say that when we cross this number, we lock down, because you have to look at the disease pattern. Where is it? How rapid? Can you explain why it's happening? Does it require lockdown? Are there better ways of addressing? I think that's what we have been doing. And we've reached 5,000 active cases, and we didn't lock down.
Well, I'll be going to Kojo also on the PCR testing. I'm sure you would want to touch on it as well. But Kingsley was asking if we know our reproductive number of transmissions and how this has been factored into our ability to contain the pandemic in the wake of the reopening of schools.
Well, we've been tracking our reproductive number. At one stage, we're doing just about 0.5. You see the number go up in Accra. But clearly, if you look at the numbers, it's really not high, except that if you look at where we have come from the last 3 or so weeks, one will see that if you don't do something and you go further, we will look at that. Many countries have used reproductive number and it didn't help them. You have to look at the situation itself, who is getting it, where are they, what are the circumstances under which these people are getting it, and address them. And I think those are the more, there are many countries who use reproductive numbers, and the day they were announcing changes, the reproductive number was going up. And so it's not something we are relying on now.
And how does our monitoring architecture look like, since we are likely to be dealing with a potentially complex situation?
Monitoring, we've been doing a lot of testing, and we test in all regions. We do our contact tracing.
Is it still as rigorous as it used to be?
Yes, it's as rigorous as it is. You see, if I get one case, let's say Western North gets one case, and there are 3 contacts, you do 4 tests, 3 tests. If you have 50 cases and there are 2,000 contacts, you do that. So the contact depends on the contact listing. Now this person who had positive, how many contacts are there? That's what depends. So you can have one case with 200 contacts. You can have a case with 1 contact. And so based on that, that is why you see periodic numbers appearing in, which is not that nobody is doing anything. Once you pick it up, you do the contacts, and we look at that. In Greater Accra alone, since up to February, we've done about 3,500 contacts. We have 330 contact tracers in Greater Accra alone who are working. Okay, yesterday we had 300 contacts that were traced. So it's going on, except that maybe that's not something that everybody sees every day. That's how numbers come out. That's how we see people test positive. That's why you get called or people come to you and test you and ask you to go and get tested. So it's actually going on. Okay,
let's. I'll come to you, Professor Kwesi, but let's go to Kojo on this one that we got from Israel. It says he thinks that Ghanaians need to take a look at the antigen-based COVID-19 test we conduct at the international airport. You want to come in before, Kojo?
Yes. You see, the antigen test is going through a significant risk. I mean, and there are people who come in there, they complain that, okay, do PCR. You do PCR the same. They are quite so close. And so, and all the people we've done, even when you do 100 and you decide to, on the quiet, do an assessment of PCR, you really get practically the same figures. And so it is very, very important. People turn positive because of the nature of the disease, because it probably takes a minute to move from negative to positive, because it's about multiplication of the virus. And so the fact that you get to the airport or you had PCR negative and get here and test positive is a vindication that the policy works. Okay, so in all those people we did, we done sequence and you see that we even identify the virus in them. So I think what we are doing is not risk elimination, it's risk reduction. And so you need to ensure that the product is something that allows people to get in, tested, and also leave the airport and leave congestion. And so I don't think anybody should look at it.
You insist this is a system
FDA has tested both and compared with PCR, and the numbers are significant enough for us to be reliable.
It's not time for a review of the process that's in place at the airport.
It's working.
Okay.
It's working since the last. We've had almost 800 positives since we started, and all those who do, we also find out that they are still positive with PCR, even if you compare.
800 positives at the KIA.
Yes, over.
Interesting. Mr. Kojo-Ponkuma, I'm sure you have a word or two on this particular system employed at the KIA. Is it time for a review? Is government considering looking at the whole system again?
I mean, I think one of the first questions is review and change to what? Change to PCR at the airport? PCR is a gold standard, and it would take 24 hours, maybe 48 hours for PCR results to be returned. What does that mean? It means that if you are to change to PCR, during that 24 or 48-hour period, everybody who enters the jurisdiction would have to be mandatorily quarantined. Are you paying for it? Is the state paying for it? Question number 2 is what Dr. Boaji Hassan said. What is the difference in terms of results between PCR, which is the gold standard and takes longer, and the antigen test? Practically none. You would notice that if the sentimental argument was true, then you are expecting a scenario in which people would test positive under PCR and antigen will not be able to pick it up. But that is not the case. Indeed, there are people who are testing negative under PCR and rather antigen is picking it up. Obviously, because of the time lag of about 72 hours, during which period you can pick it up anywhere. And let's be clear, there's a whole industry as well that is also not in favor of this antigen test. So as Israeli says in that message, you will find people around who always want to take a dig at that, reduce the price, X, Y, Z. But the president in the end has to take a decision that protects the Ghanaian population and the Ghanaian economy. And your options are limited. Do you continue to close your airports, or do you open it up with the best approach, which is the antigen approach? And that is what you have seen as a decision being made. And as Dr. Boachi says, indeed, in the end, the antigen test is working, has arrested about 800 positives, many of which were not even picked up by PCR because probably they were negative at that time, but antigen has picked it up as early as within 3 days of a potential infection. And B, we have been able to even get to the point where the new variants are being picked up under this testing regime. So I think that it's about time the criticism of the antigen testing regime, we let it rest and then we focus on what the data supports. The data tells us clearly that the decisions that have been made about protecting us from the importation of cases are working. Where we have a problem is our own domestic compliance, especially at the time when schools are reopening. And we need to pump a lot of energy in that area to ensure that we eliminate the risk that we face currently.
Quick clarification also, land borders remain closed?
Until further notice.
Okay. Well, we're going till 9:30, so please send in more of your questions. At this point, radio audience will leave us at 9. They will also continue a conversation on reopening of schools, COVID-19 related. But there was a question also on education. I have a second batch also all on education for Professor Amankwa. Well, there's a first one that was talking about teacher allowances. There's a way they always find to bring this in. Of course, if you are reopening, they have concerns about their allowances.
Yes. For any teacher who allowance was not paid, make the appropriate, launch the appropriate complaint to your district office, and then it will be taken up.
Okay, but what's the situation with it?
For us, we know that the numbers that we had, we paid virtually everyone. But once we work with technology and occasionally there will be HS here and there, it is possible that some people may not have been paid. I also hope that for those who are non-professional and we made a mistake to pay them professional, they may come up and let us know so that we can effectively deduct that. But if there is any challenge with their payment, they should lodge their complaint with their respective district offices, and then they'll bring them up for redress. Yeah.
Well, let's get into the questions, the second batch of questions quickly then. Still on WhatsApp, Raymond is asking, ask them when PPEs will be coming to schools. As at now, nobody is saying anything on that. The president just did, but they will tell you when it will come. And this one says, it's true, with few years to come, SHS students will be, is it true that few years to come, SHS students will be awarded diploma certificates? Prosper sent that. This one also has no name. It says there will soon be shortage of reagents for lab testing and PPEs for health workers. What are the plans for this? And is Ghana still practicing symptom-based testing, or asymptomatic contacts and suspected patients still have the chance of being tested? And 3, what are the plans to aggregate real-time data for more public and private testing laboratories? The president touched on that, but we'll get details. And then a scenario, he puts it, a child has recovered from the virus recently while school was closed. What is the protocol for returning that child to school? And hello, MFA, a very long one. Please kindly ask the Director General if the directive they gave for schools can be changed at the district level, because per their directives, KG to primary 6 are supposed to start lessons from 8 to 12. But when you go to the district level, certain district directors have given a different directive to teachers to close at 3 p.m. That is KG to primary 6. If our director is not aware, this is what the teachers are being told at certain districts by their directors. So they should tell the media, is it 8 to 12? But in reality, they direct the district directors to give different directives to teachers. Okay, time for closing. Okay, so Professor, we'll start from the very last one. It says, even though you've just told us that it's 8 to 12 for KG to primary 6, it appears there's a different directive at the district levels. Let's quickly touch on that.
Okay. Now, the time for the KG, as I rightly indicated, is 8 to 12. Sometimes people confuse initial discussions that we have. When we're having the initial discussions, we're looking at when schools are reopening. And once we are looking at doing our recovery and also catching up with bringing in the new one, we go to this extent. So usually you play up options. When you sit in the discussion, you play up the options. The next time, others are using some other option. But the time actually is 8 to 12.
8 to 12.
And we're going to reiterate that by sending further directives to the schools.
Okay, so there's one also on PPEs. When will it be made available to the schools? Mr. Oponkroma, we've been talking about that, but schools reopen tomorrow. You've been mentioning that you'll be having a meet the press to give all the fine details, but when exactly should parents expect that these PPEs will be made available to the schools? Do we know that right now?
Can I respond to that?
You want to respond
my understanding is that distribution has already commenced. I am sure the Director General GES will be able to give a more relevant update on how much of that has been received at the regional and district levels. But my understanding, as we started preparing, is that a good chunk of the logistics have already been distributed to the regions. Like happened last time, sometimes you have a gap between the regions and the districts and the specific schools themselves. But to the best of my knowledge, distribution has already commenced across the various regions.
Mr. Bokwamankwa, yes. Have we received them?
Yes, the distribution has commenced, as he rightly indicated. But let us also give some clarity. When schools reopened for the first phase and then the second phase, PPEs were sent out. For most of the things like Veronica buckets, etc., which are not consumables, they are still in the schools. Okay. The thermometer guns, they are still in the schools. What we need now are the consumables. So
when you say they are still in the schools, at that time we only had the JHS3 students going back to school to write their exams.
Yes.
It's the same ones they're going to use?
Yes.
But that was just for a particular, class. They were just JHS3. Yeah. If they had two buckets at the time?
They were not given specifically for the class. Okay. They were given for the school. And for most of our private, so
there will be no add-ons. We will not add more to it.
Add-ons.
Okay.
For most of our public schools, you have most of them being cluster of schools. So a lot of the time you have the primary, JHS, KG, all on the same campus. And even at that time, per the numbers that we worked out, we gave them more than enough for them to use, because we didn't want, because they were going to school for a much shorter period, we didn't want a situation where they will be queuing to be doing some of these things. So we worked it in such a way that we worked with their population and then we gave them enough where they can place them at strategic points. What also happened was that there were buffer at that time to make sure that whenever a school says they don't have it, we could send out. So as we speak now, in most areas, the supplies have started going, and we expect that within a period of about a week, all the schools would have been touched. Now, as far as health is concerned, the first person and the first group of people are the individuals and the parents to make sure that we have, you ensure the health and safety of your child. So we expect that parents, while the children are going to school, you don't say that we are going to school to go and collect the PPEs, but at least you go with the basic and initial ones whilst we wait for the ones that government is providing. So within the next week, we expect that as we go on, we will get all these things in place for the schools to go.
Okay, so Dr. Patrick Abwaji, if a child has recovered from the virus recently while school was closed, what is the protocol for returning that child to school, for instance?
Oh, thank you. I think we've had a very clear protocols for that for a while. What you do is that we have a period of 2 weeks within which when you test positive and you are not sick, 2 days after symptoms are gone, if you are sick, 2 days after no symptoms, you are clear. You don't even need a second test. If you are asymptomatic, normally 11 days is enough, but we give you 14 days. Within 14 days, you return to school. And that's how we did for the JHS and SS. They were able to go back and take the exams. And so that policy is quite clear. Teachers know, the health workers know, and we believe that when there's an outbreak or your child has one, as part of the instruction that will be given to you, all that information will be given to you.
Will there be special attention for such children?
Yes.
Because we know that the symptoms sometimes, the fatigue and all that after getting the COVID-19.
Yes. In fact, we have post-COVID clinics that even we don't just discharge you.
Okay.
We give you periodic appointment to come and be seen so that we can follow up and see whether there are any sequelae or there's some other leftover condition that we need to look at. Not necessarily the virus, but if there was any damage to any part of your body that needs attention. So that has been done. So,
but let's quickly clear this myth about COVID-19. Once you get it, can you get it again?
Well, there are evidence here and there. Not too many, but we have seen instances where people who supposedly had one probably has had a repeat a few months later. Because people don't do very, very clear science to it. Someone will ask you, are you sure the first one was confirmed or the other one? But I think we've seen enough people, some people who seem to have had it more than once, but not very close, maybe a few months after.
Okay, so there was a question also saying there will soon be a shortage of reagents for lab testing and PPE for healthcare workers. What are the plans for this? There are 3 strains, so we'll answer them quickly.
I mean, we've been managing this logistics for a while. We had a few challenges when at the time that even if you had money, you couldn't buy. But we have enough. We have enough time to also restock. And so currently, I've seen social media that we don't have this and that. Maybe some district has not gone for their swaps and they say we don't have. Doesn't mean that we don't have a national stock. We have national stock. There may be a few distribution errors here. But when we reach our buffer stock, we'll reorder.
We still haven't, completed the process for the KNUST testing kits that they produced some time back.
Well, I think that one FDA will have to.
It's still at the FDA stage.
Yes, I don't know. It probably didn't pass, and so they are probably going back to redo it and see how that can be. I think there was a question about our testing protocol. Whether
yes, are we still practicing symptom-based testing or asymptomatic contact code? Could suspected patients still have the chance of being tested?
Oh, yes. What we have is that when you say suspected cases, either you are showing some symptoms, or you are exposed, or you are a contact. That we look at that. Where we feel there's a risk, we may change the policy and do some specific mopping up. But currently, we finish all the sweeping to see where it is. We look at the risk assessment areas. We're going to markets and glory parks and car prostitutes and everyone, testing to see where are the risks. We finish all that. We have a fair idea.
Are testing prostitutes?
Well, we tested all manner of professions and to see whether are these high-risk groups, what is the distance? So those ones have been done.
Okay.
So currently, we still look at the symptom-based, but that's what we've been doing. And then if you have an exposure, like I said, we tested and all contacts are tested.
There's a third part that says, what plans do we have to aggregate data real time from more public and private testing laboratories?
Well, I think if you had a president, what we've been, when you have we had delays. And as you can see, that has fairly been done. That within 48 hours, we report figures for you. What we are looking for is to see whether we can have a real time, like on the time that you have it. Probably what you see, what we report today, for example, I saw it last night. We go through a process. Before, that's what all countries do. Go through a process and make sure your data is quality. And we're also hoping that, like the president said, the private sector enters the data. You may have done the test, but if you don't enter the data immediately, then we don't see it in time, and that one also cause a delay in response. Even though the person may have his or her results, but it takes a while for the system to be keyed in so that the district level will identify that we have a case here, we have a case there. And that's why we are.
But why would laboratories, private ones, of course, will be holding on to some of these positive cases? Well, why would they do that?
We're working with them. I think there are also capacity. There's a lot of, it's not as simple as we make it look like. There's a lot of investment in making sure that you're able to get laptop, train people to be able to key in your data immediately whilst you're still doing a lot of cases, testing, making sure you do that. But we are working with them, we are supporting them to ensure that they're able to key in the results as soon as, not just the positives, but both positive and negative, because even if somebody is negative, it's still an important information for us to see for further follow-up.
Well, so Mr. Oponkuma, does this not feed into the fact that laboratories, for instance, I have a copy of somebody's Facebook post, for instance. He puts out the results from the Noguchi, and it says that he went for a COVID test and results comes out positive. Hospital rep encouraged him to pay 500 cedis more, and they changed it to negative. Then he went to the BA, he went to London, and then found that he was positive, and then he had to be quarantined and all. And the president had calls to raise it, and that sanctions will be imposed on laboratories that do not provide adequate data. Does this not then feed into the assumptions that we may be, managing or massaging the figures when it comes, because it looks like that's not the true account that we are putting out to the public?
So first of all, when you say we are massaging figures, that presupposes that the central management or central government system knows that the figure is 100 and deliberately for some reason decides to understate it. That is not happening, I can tell you as a matter of fact. It is not even in our interest to do that. There is a reason for which sometimes there's a lag, a genuine lag in some numbers. It will be reported at the district, at the region, and then it will get to Accra. And just like Dr. Abuaje is mentioning to you, tonight, for example, they will collate close-of-day numbers. Midnight. He will see it tonight. Tomorrow morning, they will probably update. It doesn't mean that there's a massaging or suppression of figures. So I think that we should throw that conspiracy theory away. It hasn't helped since the last 9 or 10 months that we've been battling this. And it's frankly of no use to be, recycling that. But there is a genuine challenge. There's been a genuine challenge. The genuine challenge has been, as you were discussing with Dr. Abuaje, that in our bid to add on to our testing capacities, we licensed or authorized private labs also to be testing. Dr. Abuaje is being very nice and politically correct. I will be very blunt. There are a number of the labs that have been more interested in taking people's money and conducting the test than providing the public health data that is required, which would ensure that if you, MFA, go to any of these private facilities and test today, they will have your full data and make your data available in real time to the public health sector. So that, for example, if you are positive, contact tracing can start immediately. We've had several instances in which, despite what Dr. Abuaje and his team members have been impressing on them that take the data and share with us, they just don't do it. And now the Ghana Health Service is having to employ another method to get the data from them. And the president, as he mentioned tonight, has been quite clear that if you don't do it now, there will be sanctions. And I can tell you the sanctions essentially are that your facility will be stopped from conducting any further tests. Then there are those who do the test and delay in providing the information. 2 days, 3 days, 4 days. And if you take 3 or 4 days to provide that information, these positive persons will be going around spreading.
Why the delay? Have they explained?
The claims. Say again.
You can go on. I was asking why the delay. Is it that the process of transmission? What exactly is the cause of that delay, or is just deliberate not to give us the real-time data?
I don't think it's deliberate. The feedback we've had is that for some of these labs, it's been about, whether or not they will hire other personnel or extra hands to do this simultaneous data capturing, and whether it makes business sense for them to do. I'm being very blunt and honest with you here, because we need to scrape off the wound and fix it. So for some of them, it's about hiring extra hands to key in the data in real time on the platform, the software that has been developed. And that's why the president, you noticed tonight, has been very clear that sanctions will apply if you don't do it. In the meantime, Ghana Health Service is helping on the back end to ensure that they're able to comply. But we need to separate that from the claims that some are making that you can test positive and have your positive results changed to negative. First of all, assuming that is true, it's not being done by any government or public health person. It means that somebody at a private lab, at a time when we are all fighting a pandemic, is conspiring with a positive person to undermine what we are doing, and that's a different conversation. But
at least from the one that I've seen,
this thing
it's on the investor.
That's the one I'm coming to. If you take this one flying on social media about Noguchi, my understanding is that Noguchi is conducting an investigation, and perhaps by tomorrow they can give us feedback. But what I find curious is that whoever put this thing on social media, I was hoping to see the first positive and then subsequently this negative one attached to it. In this era of fake news and people cooking up stuff, I don't take things I see on social media ab initio as though they are fact. But I would have loved to see the first positive and then this negative to give me some prima facie belief that it is true. Be that as it may, Noguchi is conducting an internal investigation to ascertain whether or not these things are going on. And we are encouraging the Ghana Health Service and the Ministry of Health that all other labs that are conducting these tests must also be scrutinized to ensure that it doesn't happen. Because listen, we are fighting a pandemic. If you, the operator of the lab, because of your parochial commercial interest, you are conspiring with a positive person to change results just for commercial purposes, you are endangering the entire population and undermining the national fight. And that is why sanctions will have to apply if you are found culpable in such an enterprise.
Thank you very much, Mr. Oponkuma. But before we get into the next batch of questions, there was one also for you, Professor Amankwa. It's on whether we're going to be awarding diploma certificates to SHS students. Prosper is asking that quickly.
Okay. I think the issue about, we've done a change in curriculum. We did for the primary, the KG primary, which we call the standard-based curriculum. A continuation of that is what we call the core curriculum. Common core curriculum. And it is supposed to start with those in JHS 1. Once it starts with them, it's supposed to run for a period of about 4 years. And then when you finish, then you decide to either go into the world of work or you decide to go to continue your schooling.
Sure.
Now, once you decide that you're going into the world of work, we want to have some certificate that will show that you've gone through a period of learning that helps you to go into world of work. Then the others can also continue. So the idea is that at that point, some diploma or some certificate will be awarded. But this is a long period to come. So it's something that is part of the discussions that is going on.
But NACA told us this week, for instance, that the JHS1 program, the Common Core program that we're going to be starting, would start 8 weeks after reopening tomorrow. Meanwhile, there's been no training. We don't have test books. What exactly is the status?
Now, the program was going to start in the beginning of the academic year. So the training and everything was going to be somewhere in April, May, June. And unfortunately, we had the COVID. So what it meant was that we virtually suspended everything. When we were getting into the new academic year, the idea was to start that, and we made every preparation to train and start. But then we also realized that having stayed home for all this while, it isn't the right time to introduce a new curriculum. Rather, as I indicated, we would rather have to take the children through the recovery learning process, which takes a while. So we issued a statement, GES issued a statement, and indicated that we're going to do this recovery learning for a period of about 8 weeks.
Okay.
And the 8 weeks, let me say that it's not cast in stone. We're going to monitor because the children have stayed home. They've lost part of their second term last year, the whole of the third term, and then the whole of, and then also part of the new academic year, the first term. So virtually they've lost 2 terms and part of a term.
Yeah.
So it wouldn't be appropriate around this time to want to introduce a new curriculum. As soon as you walk into the school, then you go into a new curriculum. But whenever we decide to introduce the new curriculum, we are sure that training will be done for the teachers, and we'll put them in the situation where they will be properly prepared to handle the new program.
Okay, and once we get into the next batch, issues about school fees have also come up. I'm sure lots of parents will be nodding at this point. Once we are reopening tomorrow, school fees have been increased. Looks like sometimes double the amount. What exactly is the situation?
The public.
The good thing is that I have not increased school fees for my schools. So
that's the GES
for the GES, as far as public schools are concerned, no school fees have been increased. We don't even charge school fees in there to look at increasing them. Most of the complaints that are coming, I believe, are coming from the private schools. And having stayed home for all this while, it looks like a lot of the schools are finding different ways of charging fees. The last time, in one discussion, I indicated that we've had news that some schools are even want to charge something in connection with COVID for students to test before they go to school and things like that. And as far as we are concerned, from the health point of view, there shouldn't be any testing, and that testing shouldn't be a prerequisite for a teacher or a student
going
to
back
come
to
to
school. Okay.
You know, and then I will also indicate that if for any reason you want to charge something for some PPEs and things like that, it will rather be better to give indicate to parents that provide A, B, C, D for your child before he comes, rather than the school taking it upon itself to say that we want to charge for sanitizer, etc., etc.
Face mask.
Let us also indicate that for all the basic things that the government is supplying, they are both for private and for public schools.
So you can't charge for PPE.
And we are looking at, in all, for the pre-tertiary, the public, private students and their teachers and staff, we are looking at about 10 million, 10 million people who will be provided with the various PPEs, face masks, etc., etc.
Okay, okay. Well, let's get into the questions now. Mr. Oponkwema, I'll come to you on the school fees and whether government's attention has been drawn to this and what exactly are the measures in place for this. But let's get into the next batch of questions and we can add that too. This time on Facebook, this one is Azia or Mensa Emmanuel. It says from Ashanti region. He says, as the director, we completed school in 2017 and we haven't yet been upgraded. Why? We'll stay on Facebook. Please help us out. Some universities are demanding full payments of school fees, knowing very well that we are not in normal times. Abubakar Sadiq, still on Facebook, says, please kindly draw the attention of the Director General of Education to the fact that not all teachers receive the Teacher Professional Development Allowance. Okay, so this is something that we've dealt with already. And Nenete Nyongo is the second. What's going to be the class size for SHS? Is it still going to be 25 in the class to ensure social distancing? And Kwame Delali has a very long one. In my school, we have about 50 to 60 pupils in the class. Now that school is reopening, we don't even have enough classrooms for them, not to even talk about furniture. How are we going to manage such a situation? All efforts to let our leaders at the regional and the municipal aware of the situation have proven futile. So he's talking about the class size and also lack of logistics. Still on Facebook, Adam Ziblim Yakubu says, when will they release a second posting, including diploma holders?
That's the question.
Yeah. And then Banan Felix, it says, join us, please ask the Director General, when will the non-teaching staff be posted? We are tired of waiting.
Yes,
Teachers are really watching tonight. And Festus Osewusu says, please kindly find out from Prof, when exactly are they going to migrate us from senior superintendent 1 to principal superintendent? It has been almost 3 years. Please let them address this. It's very urgent. Thank you. And then final one on Facebook, Enokte, when will the SHS placement be released? Okay, so a number of issues for you, Prof. Placement, non-teaching staff, postings and upgrades and all. I'm sure you box them together and then we can address that quickly.
Yeah. Okay. Placement, as we indicated by our calendar, the students will be going to school on the 10th of March, all things being equal. Per our timetable, we expect that by the close of month or early February, we would have done our placement and then released.
Okay.
And we will officially announce it as we always do. And then we'll give time for people to also check and get back to us if there are issues with that. I think there's a question on non-teaching staff. Yeah, the non-teaching staff, the areas that are of concern to us now are security and then the kitchen staff, largely. The non-teaching staff covers a wide range of people, the accountants, the procurement, drivers, etc., etc. But the areas that are of great concern to us, where we need to look at, are the areas of kitchen staff and then also the security in the schools, especially in the secondary schools, where the senior high schools, where because of the double track and things like that, because of the increase in numbers, the work for these areas have been very critical. There are a couple of schools where some of these staff, as we talk of, are casual, and whenever we need to do that, they are the first point of people that we look at them. But we do a series of recruitment and different groups. So we've staggered it in such a way that we did for diploma, we've done for university, and then we are now taking up the queries and things that are coming up. When we are done with, we'll obviously move on to the non-teaching staff. But our attention, as I've indicated, will go into these areas mainly. And largely, those who are casuals are the people that we will consider first. So that will be for...
I'm sure we'll arrange for a special one for teachers and this particular issues they have. There's also an issue of the class size. He asked about the SHS 25, but let's talk about all the class sizes as we return to school tomorrow.
Yes, as we return to school tomorrow, for SHS, for example, not all of them are going at the same time. We have green, second year, and then
gold.
And then the third years who have gone to school. So largely in all the schools, we expect that there will be enough space for them to be spacing out. Yes, when you come to the primary schools, yes. There are some schools where you have numbers in excess of 50, 60, thereabout. But what we realized was that this is not something that cuts across every school. Even here in Accra, there are schools where when you go in there are about 5 or 6 students in a class. Whereas you go to some other school and then
up to 50. 50. But what should be the standard? What should be the standard amidst the pandemic as we go to school?
In fact, during the phase reopening, the observation that we made was that when we were strict on the numbers, you get to a situation where in a class, let's say they are 30, but you've indicated that beyond 25, you know, whereas the class is big enough to even do get the 30 well spaced out. You realize that there were situations that because the directive has come that it should be 25, you were moving maybe 5 people into a class. That was not conducive enough. So what we have said this time is that if the numbers are unbearable, you have to look at it case by case.
Okay.
If the numbers are unbearable and there's even the need for you to look at the possibility of doing a shift, let us know, and then you go ahead to do that. But you inform us so that we can update ourselves on these.
Okay, so I have some live ones also coming up. This one says, my son is in basic 5 and returns to schools tomorrow. He's asthmatic. Should he also wear the mask, knowing he struggles to breathe when wearing the mask?
Well, I'm sure even wearing the mask, there are situations where you may not be able to wear a mask. And if the person cannot wear the mask, we need to find some other ways to ensure that he gets treatment. I mean, there are times that the person has a very nasty cold or that he cannot wear the mask for the day, and so it has to be managed case by case.
Okay. Okay, so let me go to Mr. Oponkrumah on the issues about school fees, and there's a question also directly that who should I blame when my child goes to school and gets COVID? Government, Ghana Health Service, or the school?
Parents.
Why parents? I'm taking my child to school tomorrow and he doesn't have COVID. He comes back later, he has COVID. Who should I blame? How did I know? Well, Mr. Oponkrumah, let's deal with the issues of school fees. Let's deal with the issues of school fees first, then we can deal with the other questions that are coming up. I'm sure a hike in fees have been brought to your attention. Do you know about it?
From private schools. So government is, first of all, keenly aware that public schools have not increased their fees. And we are also aware that some private institutions have adjusted their fees. These are often arrangements, private arrangements between the schools and the parents. And as has been the norm, it has not been the business of government to be interfering and seeking to legislate fees for private schools or what parents should pay for the private arrangements that they make. But suffice to say, we are all aware that these are not ordinary times. And the best instrument is moral suasion to the operators of these private schools to also bear with parents. Yes, we understand that many of these private schools have been badly hit because of the general shutdown of schools during the period. And some may want to take advantage and recoup some money. But that is why government has also been working through the CAPBAS alleviation program to ensure that applicants who prove that they are teachers of private schools will get their disbursements done. It started already. There's expected to be a ramp up in that one. So at this stage, what we can do is to use some moral suasion to encourage private schools to also bear with parents. But to the extent that these are private arrangements between parents and the schools, it would not even be in the interest of the law or in the face of the law for government to seek to legislate what private schools should charge. The public schools, as Professor Manko has mentioned, government is able to ensure that the fees don't go beyond a particular cap.
Okay, so some schools have explained that they are going to run a semester system. So they've put all together and divided into 2. Are we running a semester system? What exactly is the situation?
The SHS already ran a semester system, but for JHS this time around, in order that we catch up with time and also to make sure that JHS is a secondary school, lower secondary school, They are also in line with the senior high school. JHS is also going to run a semester.
Okay.
Yeah,
at the primary level, that's not what it's going to be.
The primary level will still continue with their trimester.
Okay.
Yeah.
Okay. So to the question, we are just 5 minutes to go. Who bears legal responsibility if my child goes to school and catches COVID? The government, Ghana Health Service, and the school. Thankfully, I have all three of you. So I'll start with government. Do you bear the legal responsibility if my child goes to school tomorrow and catches COVID?
Well, we're interested in looking for who to blame rather than starting off on what is our collective responsibility so that we live up to it. We have responsibilities as parents. I have responsibilities as a parent as I send my children to school. The school has responsibilities. The teachers have responsibilities. We are not in ordinary times. What is required of us is that we collectively live up to that responsibility. And I'd like to encourage that is where we should channel our energies.
Ghana Health Service, you sure you put in adequate measures? Mr. Oponkrumah says we shouldn't be looking for blame, but the questioner is saying that my child is going to school tomorrow, no COVID, has been at home almost a year. I've tried to keep her away from contracting the virus. You advised that it's okay to go to school. Should I blame you?
No, I believe that if you understand the fact that no school generates the virus, it's people who work there with the virus. And so it's very difficult to say. That's why the minister is saying that this is a collective responsibility. Your child, especially those who are in day school, leave their home and come to school and closes. It's either a child or a teacher or anybody who will bring the virus there and give it to somebody. And that's why the government has provided PPEs, masks, everything to ensure that even if the virus is there, you are not able to transmit to another person. So we are doing risk communication. We're doing some joint discussions with GES, Lentas to do something we call Kofi Commando, where we're teaching children how to protect themselves. It's up to parents to encourage them to abide by the protocols. It's up to teachers to help us and caregivers. It's up to all of us, media, everybody, to tell everybody that the virus, you see, the whole ecosystem of the country, when the virus is there, then it's a risk for everybody. So whatever we all do, if we all protect ourselves, then the chance that the virus will be here. Remember what we did in Christmas and what we are suffering now. You see, it's a collective responsibility. If we were careful at that time, we probably would not be where we are now. And so that is what is create the virus that someone will carry from his home or from school to the house or whatever. So it's a collective responsibility.
Okay. So, Prof, to you now, I'm sure parents, there was a lot of panic at some point. At this time, I'm sure that after listening to you, there'll be some calm. But those who are just joining us, I'm sure a quick assurance to them that no panic, you can take your children to school tomorrow, everything is in place.
Yeah, thank you, Emefa. From the discussions that we've had, from what is going on, we want to assure all parents that everything is good. As Doc rightly said, even in the heat of the pandemic, we managed to go to school and we manage situations. Okay. But let us also indicate, and Doc is here and he will corroborate that as he indicated, we are coming from different backgrounds. We come to the school. It is most likely that within the first week or two, we may see signs of symptoms and signs among the students. We will just play that we won't be panicky about it and have sensational stories about it. We should...
As long as you also report timely when we record cases in the schools.
When cases happen in school, the protocol, the procedures is not to put it out in the news first, but all those who are supposed to be informed, especially parents, they are duly informed. Okay. And once we go through the processes, we take good care of ourselves. We abide by the safety protocols. Okay. We can all be assured that we'll be fine.
Okay, thank you.
Children need to go to school. It is very, very important. They stayed home for too long.
Well, Mr. Oponkrumah, I'll give you the final word on this. A quick question, 30 seconds. So the enforcement of the safety protocols, does it include children? Once they don't wear their mask and all, can we start telling our children that if you don't wear it, you'll be arrested?
I'm not sure the police will be arresting children. But they will use the appropriate methods to ensure that children and other persons are complying. Indeed, on Tuesday morning, the police service, the Ghana Health Service, Education Service will all join us to provide further outline at the Ministry of Information.
Thank you very much. That's the President's representative to the Ministry of Information, Kojo Ponkroma. We have the Director General of the Ghana Health Service, Dr. Patrick Abuaje, Director General of the Ghana Education Service, Professor Kwesi Opokwa-Mankwa. Thank you very much, gentlemen, for your time here on The Probe. There's more news when you log on to myjoyonline.com. Another edition of The Probe is on at 8 p.m. here on the Joy News channel. I am MFA Paul. Thanks so much for your company.